Welcome to our Psych Talk on schizophrenia. My name is Kyle Hill.
I'm Michael Scannell.
And I'm Matt Baldwin. So, as we said, our presentation is on schizophrenia. So what is schizophrenia? Schizophrenia is a serious mental disorder in which people interpret reality abnormally. It can cause hallucinations, delusions, and extremely disordered thinking and behavior, which obviously will greatly impair someone's daily function. Now, who gets schizophrenia? It can affect both men and women at equal rates and occurs in similar rates in all ethnic groups around the world. It's more common for an individual with a family history of schizophrenia, and symptoms usually arise between the ages of 16 and 30. And today, about 2.8 million adults in the United States are living with schizophrenia. So why is schizophrenia important? Schizophrenia is associated with significant health, social, and economic concerns. To list a few, it's one of the top 15 leading causes of disability worldwide. It brings with it an increased risk of premature mortality. About 5% of people with schizophrenia will die by suicide, which is a rate much higher than the general population. And financial costs associated with schizophrenia are disproportionately high relative to other chronic mental and physical health conditions. And building off of that, individuals with schizophrenia have a significantly higher poverty and homeless rates than the general population. So now I'll go over some of the symptoms of schizophrenia. So the first subdivision of schizophrenia, or of symptoms of schizophrenia, are positive symptoms. And these are symptoms that are characterized by distortions or disruptions in an individual's perception of reality, and they can be broken down into hallucinations, delusions, and disordered thinking. So first, hallucinations are sensory experiences that are not based in reality. The most common type is an auditory hallucination, which involves hearing voices or sounds that are not really present. So auditory hallucinations can be experienced as either commanding or non-commanding. Commanding meaning that they're instructing the individual to engage in certain behaviors or activities. Other types of hallucinations can include visual, meaning the person is seeing things that are not real, tactile, meaning they're feeling things that are not real, or olfactory hallucinations, which means they can smell things that are not real. Next, we have delusions, which are fixed false beliefs that are not based in reality. Now, individuals with schizophrenia can experience a range of delusions, including persecutory delusions, grandiose delusions, and somatic delusions. Persecutory delusions involve a belief that somebody is being targeted or persecuted, so they'll believe that people are out to get them or after them, when in reality no one's doing that. Grandiose delusions involve a belief that a person has special powers or abilities that they don't have. And somatic delusions involve a belief that somebody has a physical illness or condition that they don't genuinely have. Finally, disorganized thinking is when an individual has difficulty organizing their thoughts and expressing them coherently. Now, people with schizophrenia might experience thought disorder, which includes disorganized speech and thought blocking. Disorganized speech involves a person jumping from topic to topic or speaking in a way that is not coherent and very difficult for other people to follow. And thought blocking is when a person suddenly stops speaking mid-sentence and mid-thought and just their thought gets cut off. Next, we have negative symptoms of schizophrenia. And negative symptoms are characterized by deficiencies in an individual's behavior or emotional expression. So just how positive symptoms would add to somebody's experience, they would add things that don't exist, negative symptoms will pull away from somebody's reality and kind of take things away. So the first negative symptom would be a lack of motivation. So people with this symptom could have difficulty initiating and maintaining activities, and they might struggle with basic daily activities like personal hygiene. Now, this can lead to a lack of drive to pursue personal goals and interests, and could lead to a loss of enjoyment in life. A second negative symptom could be a difficulty experiencing pleasure. Now, people with this symptom find it difficult to derive pleasure from activities that they previously enjoyed, like their hobbies or spending time with friends and family. and this can obviously lead to a sense of great detachment and loss of enjoyment in the world. Finally, we have social withdrawal. Now, individuals with this negative symptom might struggle to enjoy and engage in social situations and can find it difficult to maintain and form relationships with other people, leading them to great feelings of isolation and loneliness.
Thank you, Matt. Now I will be talking about the causes of schizophrenia. So the exact cause of schizophrenia is actually unknown. However, below are some well-established theories that exist as to what factors may predispose someone to schizophrenia. These predispositions generally fall into three categories: genetic background, environmental factors, and neurological factors. So research has shown that individuals who have a family member with schizophrenia are more likely to develop the illness themselves. Studies have found that if a person has a first-degree relative, such as a parent or a sibling, with schizophrenia, their risk of developing the illness is around 10%. However, if both parents have the condition, the risk increases to 40 to 50%. Additionally, research has identified specific genes that may increase a person's risk of developing schizophrenia. One of the most well-known genetic factors associated with schizophrenia is the COMT gene. The COMT gene regulates the breakdown of dopamine, a neurotransmitter that is associated with motivation, pleasure, and reward. Variations in the COMT gene have been found to affect dopamine levels in the brain, which can increase the risk of developing schizophrenia. So now I will elaborate on environmental factors. So one environmental factor that has been linked to schizophrenia is prenatal exposure to infections or viruses. The most well-studied virus in this context is the influenza virus, which has been linked to an increased risk of schizophrenia in offspring. Traumatic experience, such as physical or sexual abuse, can trigger the onset of schizophrenia, as well as ongoing stress, such as poverty or social isolation. Finally, drug use, particularly cannabis, has also been linked to an increased risk of schizophrenia. Cannabis use during adolescence has been found to increase the risk of developing the illness later in life, particularly in individuals who are genetically susceptible. So now I will talk about a specific study on the matter. So in this study, researchers Jonathan K. Burns, Andrew Tamita, and Amy S. Kapadia explored the role of socioeconomic factors in the onset of schizophrenia. The study began with the review of already available literature regarding schizophrenia. This literature consisted of studies involving the incidence of schizophrenia that were published between January 1975 and March of 2011. Using data from the analyzed study, the incident rate of schizophrenia was expressed in terms of per 100,000 of the population. From there, income inequality was measured using the Gini coefficient. The Gini coefficient of certain areas were compared with their incidence of schizophrenia. The researchers discovered that income inequality and incidence of schizophrenia were heavily positively correlated. Now I will elaborate on the neurological factors of schizophrenia. So one known abnormality associated with schizophrenia is a decrease in brain volume, particularly in the frontal and temporal lobes. These brain regions are responsible for processing information related to memory, language, emotion, and decision-making. This decrease in brain volume is thought to contribute to the cognitive and emotional deficits associated with schizophrenia. Abnormalities in brain function have also been observed in individuals with schizophrenia. Studies using brain imaging techniques, such as magnetic resonance imaging and positron emission tomography, have shown that individuals with schizophrenia have abnormal patterns of brain activity. Specifically, they have decreased activation in the prefrontal cortex, which is responsible for decision-making, problem-solving, and working memory. Additionally, studies have found that individuals with schizophrenia have abnormal levels of neurotransmitters in their brains. Neurotransmitters are chemicals that allow brain cells to communicate with each other, and abnormalities in neurotransmitter levels can affect brain function. One neurotransmitter that is particularly implicated in schizophrenia is dopamine. Abnormalities in dopamine levels have been found to contribute to the development of psychosis and other symptoms of schizophrenia. So now I'm going to talk about a second study that explores the genetic factors affecting schizophrenia. So numerous studies have shown that the levels of interleukin-2, a growth factor that regulates the autocrine signaling process of T cells in people inflicted by schizophrenia, are different when compared to a control group of people without schizophrenia. In one study, the relationship between interleukin-2 and genes making one susceptible for schizophrenia in 230 patients was analyzed. In the 230 patients analyzed, a significant association was found between the interleukin-2 330TT genotype and schizophrenia. Furthermore, in another study, the expression between interleukin-2RG gene and schizophrenia was analyzed by testing the mRNA expression in the peripheral blood of 66 schizophrenic patients and 99 healthy subjects. The results found an upregulation of interleukin-2RG mRNA in the blood of the schizophrenic patients when compared to the control group. These results suggest that the overexpression of interleukin-2RG is potentially linked to the altered immune response typical of schizophrenics.
Thank you, Kyle. So we've talked about the causes and the symptoms, both positive and negative, of schizophrenia. Now we're going to talk a little bit about the treatment. According to the DSM-5, after a psychiatrist diagnoses a person with schizophrenia, there are several methods of treatment that can allow an individual to function in everyday life. However, there is still no definitive cure to schizophrenia. As a result, any treatment is designed to ease symptoms, not completely eliminate the existence of schizophrenia in an individual. Treatment will generally fall under two branches: cognitive behavior therapy and antipsychotic medication. So the cognitive behavioral therapy, CBT, aims to help schizophrenic individuals identify the thinking patterns that are causing them to have unwanted feelings and behavior, and learn to change this thinking with more realistic and useful thoughts. For example, they may be taught to recognize examples of delusional thinking, and then receive help and advice about how to avoid acting on these thoughts. In therapy, it is also very important to involve family members to construct a support system for a schizophrenic individual. With the prevalence of manic episodes in people with schizophrenia, it is crucial that there are people who are able to intervene and de-escalate a situation when it arises. Antipsychotic medication. It is believed that the overactivity of dopamine in certain areas of the brain is responsible for the positive symptoms of schizophrenia. Thus, antipsychotic medication works by blocking the action of dopamine in these areas, which reduces the severity and frequency of positive symptoms, such as hallucinations and delusions. Antipsychotic medication can also help to improve negative symptoms, such as lack of motivation, social withdrawal, and difficulties with speech and communication. However, these improvements may take longer to appear than improvements in positive symptoms. Antipsychotic medication continued. So we're just going to talk a little bit more about it. Can be classified into two categories: typical and atypical. Typical antipsychotics were the first medications used to treat schizophrenia and are also known as first-generation antipsychotics. While effective at reducing positive symptoms, they may cause more side effects than atypical antipsychotics. And these atypical antipsychotics are also known as the second generation, which makes sense, are newer medications that are effective at treating both positive and negative symptoms of schizophrenia. Atypical antipsychotics are generally better tolerated than typical antipsychotics and have fewer side effects. And there is a third study that we're going to talk about, and it is about medication adherence. A significant factor affecting the efficiency of antipsychotics is medication adherence. Treatment for schizophrenia is worthless if a patient refuses to undergo it, so if it is important to address the relationship the parents have with their medication. In a particular study of not adhering to prescribed schizophrenia medication, adherence to medication was assessed with the DAI-30, a self-administered questionnaire composed of 30 questions, with a higher score meaning the patient showed a more favorable attitude towards medication adherence. At the end of the study, 26 of the participants were in the recovery group, and then 44 were in the non-recovery group. 13 of these participants were then removed from the analysis due to missing values. The study found a statistically significant association between impression of medication and the functional prognosis of schizophrenia, suggesting that having a positive view of one's medication might help one's recovery from schizophrenia. The study suggests that impression of medication has the most significant impact on medication adherence out of all the factors affecting it. And people have a lot of predetermined behavior about people with schizophrenia, so these are some misconceptions about these people. The first one is that schizophrenia is the same as having multiple personalities. This is not true, but it is a common misconception. Schizophrenia and multiple personality disorder, which is now known as dissociative identity disorder, are two distinct different disorders. And the second one, people say that people with schizophrenia are dangerous or violent. This is also not true, and it's a harmful stereotype that is not supported by research and is greatly aided by pop culture, which often depicts schizophrenic characters in movies and TV shows as crazed killers. While individuals with schizophrenia may experience hallucinations or delusions, they are no more likely to be violent than the general population. And the conclusion. So we've talked about how schizophrenia is a serious mental disorder that can cause hallucinations, delusions, and extremely disordered thinking and behavior. It affects both sexes and all races equally, and usually arises in young adulthood. While the exact cause is unknown, schizophrenia is greatly influenced by an individual's genetic background, the environmental factors they experience, and neurological factors in brain structure and chemistry. And lastly, like we just talked about, there's no definitive cure for schizophrenia. Both cognitive behavioral therapy and antipsychotic medication, symptoms can be reduced to the point where an affected individual can function normally in society. Thank you.